Let's go ahead and get started. I have 12:05. So good afternoon, everyone. Thank you so much for joining. My name is Lena Watts, and I'm the Secretary for CAHAM, and I want to welcome you to our webinar today, and that is on the patient affordability conundrum. Today we have speaking for us is John Fistner. He is the AblePay founder and CEO. And if I could just share a bit about his background. From his experience as a CFO and COO of a hospital network, John saw the inefficiency in healthcare and set out to create a solution. He founded AblePay Health in 2016 to address the impact of increasing out-of-pocket medical expenses on patients and medical providers. Over the past 5 years, the unique business model has changed how hospitals, health systems, and specialty providers look at post-insurance patient reimbursements. The program is also assisting healthcare consumers with paying for their responsibility. In addition to AblePay, John has started 2 other successful business ventures, which are still operating. John graduated from Lafayette College, where he was a captain, first team All-Patriot League, and All-East Coast Athletic Conference linebacker. He received an MBA in finance from Lehigh University while building the hospital network. So without further ado, I'd like to welcome John Fistner.
Thanks, Lena. Appreciate that. I didn't know we were going back to the college days. It's been a long time since I put on a helmet. I can tell you that. You know, the extent of my football career is coaching my kids now. So I got 13, 12, and 11-year-old boys. So I'm still coaching that 5th and 6th grade level, which is a blast. So thanks for the intro. Appreciate that. Just give a little bit, about AblePay and kind of how we got here, and then we'll get into some of the details on this very interesting topic, at least to me. So we started AblePay in 2016, trying to address this growing out-of-pocket healthcare expense issue. And, many people thought of my hospital contacts, many people thought that it was crazy trying to get into, the collections on the patient balance side, which is obviously very difficult and getting more difficult. But I saw that there was an opportunity. I didn't think the market was really addressing what I consider the core issue, which is the patient payment behavior and affordability. And we'll address the aspects of that in this discussion today. And then we'll get into some information about AblePay and, kind of where we're going. So thanks for the time. If there's not anything to start with, I guess I'll go ahead and start the presentation here. So for the agenda, we'll talk about the current provider market state. We'll go into cost of healthcare, the debt crisis, and some other issues as it relates to that. Approaches to solving this problem, not just from AblePay's point of view, but also other partners in the industry that are trying to address this problem. The evolution of AblePay model and other payment solutions, and then some case study work of the results we've been able to achieve. Obviously, providers are critical to U.S. systems. These are some big numbers here, and a lot of this initial part of the presentation is data. So I'll try to move pretty quickly through it. A lot of the stuff you'll know. Some of the stuff I don't think you will. So it'll be new to the discussion. But you got 6,000 hospitals. There's 18 million people across the country in this industry. 33 million total annual admissions, and 1.2 trillion in total expenses with the hospitals. There's all kinds of challenges, and from my background, I was a CFO, a chief operating officer of a hospital, and I haven't been on that side of this since 2012 when I left and became an entrepreneur and began to start companies. But I always felt like 2008 was a really challenging year for the industry with multiple pressures, big, technology conversions, that kind of thing. I think it's 10 times worse right now to be an administrator and to deal with all the problems that you guys deal with on a regular basis. Mounting pressures, obviously patient payments, which is our focus, but declining margins, increased regulation, industry consolidation, staffing shortages, cybersecurity threats, which we were all dealing with. So lots of pressures from all sides, really, it feels like. So I don't envy your current roles in this current marketplace. From the patient payment side, affordability is the root cause of poor patient collections, right? And we'll kind of dig into some data on that. Cost of healthcare has far outpaced consumer inflation. You can see healthcare as a percentage of GDP of the last 60 years has grown to over 20%. We're talking spending reaching 4.1 trillion here in 2020. Okay, far outpacing medical patient inflation is far outpacing consumer inflation. Healthcare in the U.S. is really expensive. Just visually, you can see here, far outpacing the next closest country in Switzerland. So as a percentage of GDP, it's a significant part of our economy. And we spend more in the U.S. than any other industrialized country. Just as a kind of funny, not so funny, not everything's more expensive in the U.S. It is cheaper, to get a burger here in the U.S. than it is in any other part of the country, right? Or any other part of the world. Since 2000, hospitals have provided over $745 billion in uncompensated care. So you could see after the Affordable Care Act was passed that does come down, but it is creeping back up as the market continues to grow and more out-of-pocket collections are falling. More collections are falling on the patients themselves. High deductible health plans have contributed to the rise of uncompensated care. 53% of consumers are enrolled in high deductible health plans in 2020, up from 39%. I can remember when I was a CFO at the hospital introducing high deductible health plans pretty early. I think it was 2005 when we were rolling them out and trying to explain to all our employees how it would work. And that's now become the majority of health plans throughout the country. Average deductible is $2,000. That's from 2021. And half of U.S. adults don't have the cash to cover an unexpected $500 expense. So here we are pushing more and more deductibles, co-insurance onto patients to keep the premiums down, but they're really not in a position to pay, and that is ultimately resulting and impacting in your collection experience on the hospital side. Most bad debt does come from insured patients, right? 58% of patient bad debt in 2021 came from self-pay, we call balance after insurance. So more and more is falling under insured patients. It's not just the uninsured, the straight self-pay that are falling to bad debt. It's a number one reason for bankruptcy in the U.S. 66% of all personal bankruptcies are due to medical bills, which is kind of a sad state of our country. At this point, 18% of Americans borrow money to cover healthcare expenses. 60% has had some sort of medical debt at some point in their lives, and 70% of Americans with medical bills had to lower their spending on food to avoid bankruptcy. Right. This is a stat that's thrown out a lot. 41% of Americans currently owe debt to hospitals. You can see how it's broken down. So bills past due, or they can't pay, payment plan set up, they owe a collection company or a bank, they put it on a credit card, or they owe to a family member or friend. So total of some kind of healthcare debt is 41% of the country. Even with the rise with medical debt, most patients still do not pay their bill in full, right? So 2 out of 3 patients paid less than half of their responsibility. 50% of patients owed less than $1,000 as part of their bill. So fifth of the patients that owed less than $1,000, only 50% of that amount was paid. So how much do providers actually collect? I'm sure you guys all have a feel of your collectible percentage. I could tell you we're from the East Coast. I'm in Pennsylvania right now, in Allentown, Pennsylvania. That's where our headquarters are. And the collectible percentage generally in our region is about 40 cents on a dollar. It tends to go north as you go up Route 95 on the East Coast here. Towards Maine, the collectible percentage does go up. As you go down Route 95 towards Florida, it goes down, with some of our Florida clients talking about 25% collections on patient out of pocket. So some significant differences. I'd say the average from the 10 states that we're in right now is about 35 to 40 cents on a dollar. On uninsured patients, you're looking at collecting 9% of that money. On insured patients, 44%. The statistical numbers we've kind of seen throughout the country on collectible percentage on patient out-of-pocket expenses. It also decreases over time, right? So for every 30 days an account is in AR, it reduces 30% the likelihood that you're going to collect. 6% of the odds of patient paying off the debt by the time you send the forced statement. So as you go out over time, 30, 60, 90, 120, obviously it makes sense. The likelihood to collect does go down. It's also very stressful for consumers. So 34% had to find other ways to pay for their healthcare bills outside of the hospital. 75% of health insured consumers are concerned about the financial hardship, about their financial hardship due to medical bills. And 87% of consumers were surprised by a medical bill in 2021. We see a lot of interesting figures as it relates to, the surprise bills, if you will. It's not just people that are on the low end of the spectrum, right? Okay. Affordability is affecting everybody. 1 in 3 Americans did not seek care due to cost. 1 in 5 people among higher income households. So if you're earning more than $120,000 in your household, 20% of those individuals are also choosing not to receive care because of cost. So it's not just those on the lower end of the spectrum, financial means, but also on the high end as well. It's affecting everybody. People also, they don't even understand how this works. So it's a really complicated process. We've all on this call spent our adult lives kind of in this space and trying to address these problems in healthcare and understand these problems in healthcare. But 96% of Americans cannot define what coinsurance is, deductibles, copays, or out-of-pocket maximums even are. So if you don't understand something, it makes it much less likely that you're actually going to pay for something. But I always focus on that copay line. So think in my mind, about 50% of people don't even know what a copay is, right? This causes friction, right? Exists between the patient payment preferences and provider payment systems, right? Say that 5 times. On the provider side, current state, it's reliance on paper, manual processes. I think we continue to evolve that model, and that's changing pretty quickly. The increased number of different options for e-payment create a fragmented process and a slow adoption for electronic payments across the spectrum. I'd say the bigger systems are already transitioning and put those things in place, but the smaller systems, haven't necessarily converted to that model. From the patient's perspective, though, what they're looking for and preferences for payment, 63% went online, 23% went check or mail, 7% went phone, and 7% want to walk in and still pay their check in person. So when asked how well we're doing, U.S. healthcare in the U.S. or healthcare in the U.S., how well are we doing? The response is 56% said not well at all, right? And I think we've all been on the other side of this system because we're all patients, right? So we've kind of walked in and been frustrated with maybe the time to get in for care, the billing process as it relates to the hospital, the differences between different providers. And I think this culminates here with the answer. 56% say healthcare isn't great. 32% we're doing okay, and only 12% think healthcare is doing extremely well. So I think a lot of it has on the clinical side. We're pretty happy with our care once we actually get to the doctor and have the care, but we're frustrated with our experience kind of before and after. On the affordability grade, 3 out of 4 Americans say a D or F grade for healthcare and how much it costs us. And that gets into really why don't patients pay, right? Adding interest and fees doesn't really solve the healthcare affordability problem. Extending payment terms does not reduce the cost of healthcare. It actually could increase the cost of healthcare. It's really confusing, right? So it's not affordable. It's confusing. It's not transparent. We don't really understand what we're being billed beforehand. I know we're doing, we're trying to make changes to that to make that better. So you don't really have clarity of what it's going to cost you. And it's very difficult, right? Expect a consumer-like experience, and we don't really have that in healthcare at this time compared to, say, our experience with Amazon or some other technical experiences. Is just not quite there. It's making it easier to pay doesn't really solve the affordability problems. There's a lot of different points that it relates to billing patients that really affect their experience and ultimately culminates in why people don't pay. Providers have several options to improve revenue and patient satisfaction. You can kind of look at this list here. You have patient financing tools. You have payment experience tools that we're adding into our billing systems, and there's ultimately changes in patient payment behavior. And you can see those different points on the bottom of the screen here, and how those different programs can impact the collections and the patient experience. So it continues, patient financing, just to focus on that for a second, continues to generate negative headlines. You can see the quotes here. Hospitals and other medical providers are pushing millions to credit cards, right? So we personally at AblePay don't believe that we should be adding interest to an already expensive process, but that's what some hospitals are doing. A lot of money is being made capitalizing on patients' inability to pay. So we're pushing more on deductibles, more on co-insurance, and there has to be some way to pay that. And people are looking to financing tools that do come with interest, and that just adds to the cost of healthcare and makes healthcare more expensive in the U.S. As this happens, right, and more money is being pushed into credit cards and medical debt, patients are increasingly dissatisfied, right? So you see this massive increase in patient financing from 2013 to 2022, up to 9.6 billion. And the patient reviews in general, are not great, right? When you get pushed into this financing, it does come with interest, and people don't necessarily understand all the terms that are associated with that process. One of the particular vendors that are out there on the financing side, and many, this is kind of a commonly used company that's out there. You can see as things get worse in the economy and people have to turn towards these types of programs, you could see revenue increases, right? So a lot of money is being put into interest in these programs, where I think it should be staying home and ending up with providers. And not with financing companies charging interest. It's evolving away from that. So the market's evolving away at this point to try to address affordability in the patient experience. From patient financing, you can see that as the black line here, that 9.6 billion. It kind of ramped up significantly. On the payment experience side, the market is much smaller, but continues to grow at a 15 to 40% compound annual growth rate. And those focused on patient payment behavior, which is AblePay. It's a fast growing market, but much smaller than the patient financing market and the payment experience. So what is AblePay, and how does it fit into this model? So what we do, we make care more affordable by offering savings to the patient. So all our patients have an opportunity to save. We give them flexibility with savings over a period of time, so they can pick and choose on every single bill how to pay it. So do you want to pay it with the most discount? You want to pay it with a smaller discount? It's really easy and convenient. So it is a member facing platform. So if you go to, say, Chalk, who we're just about to roll out with, versus another hospital down the street, all of your bills come into AblePay. So you can pay multiple provider hospital bills all in the same space. And then we back that with a whole team of advocates, which is unique to the industry. So you can call, you ask questions. We take some of those questions off the customer service reps at the hospital. And ultimately what we're doing is building trust with your patient, which also ultimately becomes our member. And what we say is, trust equals payment. So, you got to educate them. You got to help them understand their bill. And if you do that, it does ultimately end up in payment. Here's a list of our partners. Again, we started on the East Coast. I mentioned that. So we're in Eastern Pennsylvania, about an hour north of Philadelphia, an hour and a half west of New York City, but we've been migrating throughout the country. We are throughout the country west. We are in 10 states now. We have hospital association endorsements from 10 states. We have payer partnerships, although that's not necessary to the model, but this will give you a feel of the organizations that we partner with. We are the fastest growing healthcare company in Pennsylvania. We're the 22nd fastest growing healthcare company across the country. And out of all industries, we're 381st. Here are some results on the patient experience side. So it's not just about increasing revenue with a collectible percentage change, but and additional services, but it's also about the patient experience. Our average is a 64% increase in overall satisfaction with the billing process. Our net promoter score of 69 is something that I'm really proud of, right? Being in the health insurance industry, being in related to the provider side, right? The average is about 31. So we've been able to achieve much higher results than the industry average. So how does AblePay work? I'll just walk you through a transaction. We'll use Terry, right? So Terry's going to walk in to Children's Hospital of Orange County. She's going to present her insurance card and then her AblePay card like a secondary, right? So we're going to put AblePay in like a secondary. The bill is going to go out to her insurance company. It doesn't matter what it is. It's going to get adjudicated. So let's say it's a $10,000 charge. It's a $5,000 allowable, and Terry has a $1,000 deductible. So Chalk still gets their $4,000, but that $1,000, instead of going to Terry directly as a patient, that comes to AblePay. We receive the bill as an 837. We then would take a discount that we've negotiated, and we pay back Chalk in 2 weeks with no recourse. So this is a full no recourse model. We take risk on every patient. We accept everyone that comes in from Chalk, regardless of their financial situation. And then Terry, as a consumer, she's going to have an opportunity to pay over a period of time. Let's show you that here. So if she pays in one payment, she can get up to a 13% savings. It does go down if you use a credit card because of the fees. You could pay over 3, 6, 12 months, 24 months, and then the discount declines over a period of time. So on a $1,000 bill, Terry can save $130 on that bill, but the full $1,000 still goes towards her deductible, and she can do that on every single bill. So on the screen here, just to walk through that process, you're going to sign a contract with the provider. The provider is actually going to market it directly to the patient. So pre-service, at time of service, post-service, they'll present their AblePay card at the time of service. And then as we walk through that transaction with Terry, Chalk bills us, we pay them back in 2 weeks with no recourse. And there's no integration involved in that process. We use the payer rails to process payment. So it's just like putting us on, it's putting somebody in as a payer. So whether it's Aetna, United, or AblePay, it's the same way. And then we work in, through the clearinghouse world to move those transactions. Here you can see, like in the current model, say it's $100,000 owed, you get paid some over time. And if we say you collect 40 cents on a dollar, you ultimately receive that money over some period of time. With AblePay's model, you're going to get that money up front. You're going to get it in 2 weeks. It'll be with no recourse. There's no interest, there's no fees, there's no penalties. You can choose the terms on every single bill. You have the whole member team on the back end and kind of qualify those as the member benefits. On the provider benefit side, full risk solution, no recourse. Use the clearinghouse rails, 837, 835 back. Our track record, we're changing collectible percentage on the same patients by 50%. So you got a big lift just on the collectible percentage side. It's really easy. You put us into the system. It takes 15 minutes to add us as a payer. You get paid in 14 days with no recourse, and we're going to do a great job with your patients. From a comparison standpoint, from a provider perspective, if you look at these, different types or different aspects of the system. So whether it's ER integration, billing expense, patient adoption, time to collect, or increases in revenue. You can kind of see this red, yellow, green highlight here. So if we said on the patient financing side, from a payment experience, there's a pretty significant lift in system integration, right? On patient financing side, it's not so much. With AblePay, it really is nothing, right? You just got to put us in as a payer. From a billing side, there's no invoicing, there's no processing and invoicing, there's no flat fees or monthly fees to join the program. From a patient adoption standpoint, you actually get a lot more throughput for the patient experience tools. From the patient financing tools, it's actually a smaller amount of people are in those programs. From an AblePay perspective, we're driving over 30% of patient out of pocket through us. Time to collect on the patient financing side and the AblePay side, it's really easy. You're going to get that money turned around pretty quickly. But you can see the impact on the right. So implementing a patient financing tool, you're probably around 5% to 10% of patient out of pocket. Patient experience tools making it easier to pay, you'll see a lift between 10 and 35%. And if you add AblePay as a tool to your program, you're looking at over 50% collection rate on the same patients. And just of note too, these tools can all be combined together, right? So just because, say, you have a patient financing tool like Care Payment or Clear Balance, right, or Cure, you could still have AblePay, right? If you have a patient experience tool like Cedar or Visit Pay or Patient Co, right, you can still have AblePay, right, and integrate that into your workflow and use this as another tool. From a patient's perspective, right, from the patient financing side, it comes with additional costs. So there's a yellow there. Payment experience side, there's really no cost. It's very easy to use and enroll in the experience platform, enroll in the AblePay platform. From an interest expense, you can see the cost. From a patient satisfaction, both the experience side and the AblePay side is really easy. From an advocacy standpoint, we're really offering a full suite of services on the back end to help people understand the bills, and ultimately, from an AblePay perspective, we're saving patients money as well, which is the only tool that does that. So walk you through St. Luke's case study. So we are talking about St. Luke's in Pennsylvania. I know there's a couple of St. Luke's throughout the country. They're about a $3 billion system overall, $3.4 billion if you include the PB side and the HB side. 14 campuses, multiple outpatient clinics. So pretty large, robust system. This was our first partner, St. Luke's Health, University Health Network. We did increase revenue by 50%. There was a 40% increase in out-of-pocket revenue per patient. So we didn't dig into this too much. We will now is that it's not just about the collectible percentage change, but our patients are getting 30 to 40% more services with the protection of AblePay, right? We reduced the collection days to collect from 111 days down to 14 days as well. So back to changing patient behavior and how it's possible for us to increase services on the back end once a member has enrolled. I think it really speaks to this survey question that we asked from our members. So prior to having AblePay, did you ever forego or postpone receiving care due to cost? The answer is 31% said yes, right? So it speaks to that affordability issue. And then now that you have the financial security and protection of AblePay, have you received care that you otherwise would have foregone or postponed due to the expense? And 20% said yes. So they're getting more services because they know on the back end, they have the trust of AblePay, the bills are going to be right, and they'll have the flexibility to pay over time and save money over time. As far as impact goes with AblePay, you can think of it in simple terms. For every 1,000 members that come into the program, there'll be about $1 million in patient out of pocket that flows to us. And we're netting you back over $1 million in cash impact, not just from the collectible percentage change, but also the additional services that will come in from the insurance company payment, as well as the additional out of pocket payment for those services. So $1 million to AblePay, net cash impact of another $1 million back to the organization. We got Cupcake here, Kelly, on the screen here. So if you have For contact information, Kelly's information is here. Here's her direct number, email address, and she's obviously involved in KHAM, which we thank really much. Thank you very much for having us today and giving us the opportunity to present to the group. I will pause here and stop sharing and ask what kind of questions you have about the affordability issue, as well as about AblePay specifically.
So this is Terry, not Terry the patient, Terry the revenue cycle director at CHOC. And maybe you mentioned it, and maybe it was when I was multitasking a little bit, but you forgot to mention the thing that was one of the two things that was really super attractive to me when we went through this negotiation, and that is that it will bring down your AR days, right? These payment plans that we use internally stay, at least for my hospital organization and we're on Cerner, they stay on your books, right? So if AblePay takes it off your books in 14 days, that's definitely going to help with your days in AR.
Yes, thanks, Terry, for pointing that out. The average days in AR for patient out of pocket from our clients has been between 100 and 120 days. Right. So we are turning that around in 14 days, and that's kind of an across the board part of the program. So regardless if you're, at CHOC or you're at Penn or you're at Tower, you get that money turned around in 14 days. Terry, and with some of the changes this year and the pressure on hospitals, we're now being asked to pick up those payment plans too. So we do have the option to acquire those payment plans if you did want them off the books, or just on a go forward basis. We have clients now routing all payment plans through AblePay as well.
That would certainly help with AI as well. So
yeah. Okay, I got a question. If an account has services from different AblePay clients, can the guarantor combine in a one payment plan? Yes, they can. So we do have intentionally. This from Rosa Maria. So intentionally, our members have asked us to separate claims individually. So they want to see, this is my anesthesia bill, this is my hospital bill, this is my doctor bill, this is the data service. They want to see them individually, and a lot of the market is going in a different direction and consolidating like a credit card, but you don't have all the details necessarily to be comfortable with the bill. So we do separate it, but yes, you can combine those payments from disparate providers into one monthly payment.
And is there a minimum payment amount?
No. So it does help with small balances too. So when we looked up some of the case study details that we had, we would see St. Luke's had some 90% collection rates prior to signing up to AblePay, 80%. A lot of it had to do with the small balance write-off. So we pay everything down to $1. We have a lot of lab bills that come in with small dollar amounts. So that's not a problem. There's no minimum. There's also no maximum either. So there's no threshold. You're not getting approved for credit in any way. We're not checking credit. We're not doing even soft checks. So everybody's coming into the program, and there's no minimums, no maximums.
And
Barbara,
yep, there's more. How long can a patient stretch their payment plans? 12, 18 months?
Yes. So we try to keep people within 12-month window, but we do extend terms out to 24 months for straight balance after insurance.
And what if there is no insurance?
Yeah, we can handle that as well. Most of our providers are focused on the balance after insurance, but we can handle self-pay. We can handle non-covered services like gastric bypass and hearing aids and plastics too.
Oh, no.
Barbara, do you have a question? I'm sorry. I think you have your hand up.
This is Claudia. I don't know why I'm showing as Barbara, but this is Claudia from the pre-reg team.
Okay. All right.
I think that's what it is. I'm not sure because I did raise my hand.
Yeah.
So pre-registration, we call families, we attempt to collect upfront. How would you say the best way to offer a patient to sign up for AblePay? I do see the brochure and how to present it to the family. But from a phone perspective, how would we offer that?
Yeah, so we do have the links directly from you guys that you can send to them over, text if you had it, email to have it. You can point them to the landing pages that we do create, so you can go right onto there and they can hit enroll and enroll into the program. If there's a requirement that you have that they're enrolled in AblePay prior to having the services, there's communication on the back end that we can exchange. We do that with pre-collection teams at other hospitals. So they're involved in AblePay and you don't have to cancel their appointment because they're part of the program, even though they didn't pay up front.
Okay. Okay. Thank you.
No problem. Other questions on the program? Kelly, is there anything that I missed that you want to add?
No, I appreciate that I'm sweet thanks to Terry and that I have a new internal nickname, but no, I appreciate that you asked. Thank you for leading the charge today. And I just obviously want to thank KHAM and see if there are any one last go for questions. I'm actually going to put my contact information in the chat now. So if anyone does come up a question afterwards or wants to reach out for further details, you can certainly reach out to me.
Kelly, there was a fourth question that came in.
Yeah,
I'm sorry.
I see that. I see that. The question is, what if a patient defaults? So I think it's important to understand that everybody's in the program, right? And we do follow the 501R collection process for AblePay. It's 4 calls, 4 emails or text messages, a letter, 30 days, another letter, and then 30 days, the final letter. So AblePay has never sent anyone to a third-party collections and has never reported their credit to the credit agency either. This is not a debt collection company, right? So we don't buy your debt and chase people down. Everyone is voluntarily deciding to participate in the program. So it's a different type of relationship. I would say closer to the relationship that you all have with your patients. You want them to keep coming back. You want them to have services. And I think, that's not only the right thing to do, but it's good for the business model. That's the only way AblePay creates revenue, is if we are, people are continuing to have services. So we do everything we can to try to keep people in the program, adjust terms accordingly, and work with them to address whatever personal needs they have, whether they lost a job or, they have other pressures because of the economy, et cetera. They're like our patients, right? So we're doing everything we can to try to help them. Okay, other questions?
Did Rosa Maria get all of her questions addressed? There's quite a few of them.
Is it, Terry, this is Claudia. Is
Yeah.
this something we can start offering to our patients now, or do we have to, is there like a go live or?
Yeah, so we can't actually start offering it to them now. It says that is as soon as, because we won't have any payment in the system yet, right? David was having the plan code put in so that we could put it in the second positioned. But in that case that we talked about this morning, that's a perfectly good case to start. It is. Absolutely, yeah.
I'm sorry, is that a yes? I can offer the family already?
That's a yes.
Oh, perfect. Okay, mom did call me back, but obviously we're in a meeting, so I'll call her back. I'll start the first, I'll introduce and then we'll go from there.
Yeah, and let me know how receptive she was to it. That would be great. Yeah.
Perfect.
How do you like
you?
Yeah.
Yes, I love it. Yes.
Yeah.
Thank you. I think that's it on my end.
Okay.
Thank you.
All right, we'll give you some time back in your day. I know we blew through that fast, but I hope you picked up on some of the background on what's going on in the place, and how AblePay can help your teams. Please reach out to Kelly. She's great. We can utilize her as the go-between and kind of get a conversation going. So thank you for your time. I'll let you get back to watching some March Madness here.
Oh, gosh. Thank
We
you.
are working
Thank
hard. We're not, nobody's
Yeah.
watching.
Yeah.
Does that? Thank you,
Well,
John.
Thank
Take
you,
care.
John. Thank you,
Thank you,
Kelly.
guys.
We appreciate you.
Thank you.
Thank you for
Have
the
a good
attention.
afternoon, everyone. Thank you for your time today.
Thank you.
Lena.
Take care.
Bye-bye.